Okay. So this is my NG tube video with gastric lavage and gavage. I have my order sheet letting me know for gavage and lavage what the orders are, as well as the suctioning. I have the tray, gloves. Okay, so I'm gonna start off with my safety rights. So I would verify the physician's orders for the client. I would perform hand hygiene before and after performing patient care. I would verify the facility's policies and procedures regarding the skill that I'm about to perform. I would gather the necessary equipment. I would consult the manufacturer's recommendations on how to use said equipment that I've gathered. I would knock, ID, and greet the patient using 2 identifiers and myself. I would note the overall condition of the patient. I would explain the procedure and provide for privacy before I start the skill. I would raise the bed like I have done, to good working mechanics, don PPE if necessary, perform the skill, lower the bed, put the call light within reach, the side rails within safety orders, and report and record any findings to the charge nurse and document. So we have Mr. Gastritis. So hi, Mr. Gastritis. I'm Christina. I'm going to be your nurse today. We're going to be giving you an NG tube and doing what we call lavage and gavage, which is instilling water into your abdomen until it runs clear and then giving you a tube feeding. If that sounds okay, I'm going to go ahead and get started. Have you had any facial trauma, any deviated septums, any abdominal surgeries, gastric bypass, gastric band, lat band, anything like that that I need to be aware of? He said no. I assess his nares, so I will occlude one, have him breathe out the other, and whichever one is more open, more dilated, I'm going to use that one. Today it's going to be his left nostril. So I would also do a focused abdominal. I would listen to the bowel quadrants first before I palpated. I listen, inspect, palpate. No tenderness, no abnormalities, no findings that would instruct me that I needed to hold off on this skill. So I'm going to, this is packaged. This is not just hanging around like this. I just opened this. Before I touch the equipment, I wash my hands. I'm putting on gloves. Okay. So Mr. Gastritis, what I'm going to do now is just measure you so I get the correct length of the tube so we don't go too far or too shallow, okay? So you're just going to feel me touch the tip of your nose to your ear and then down to your xiphoid process. And I'm going to put a little bit of tape right there so I know when to stop, okay? I'm going to set this back in the original packaging so it doesn't get dirty. So I also have a cup of water for when it goes in the back of his throat, so we don't go down into his lungs, we go into the stomach where we want to be. So we're going to go ahead and get started. So whichever tube the hospital comes with, there's going to be lubrication either in the form of a packet or it's water activated. This one I'm going to say is water activated, so I'm going to dip it in the water, activate the lubricant so it's more comfortable going down his throat. So Mr. Gastritis, could you leave your head back for me so I get a good look at your nostrils? Okay. Now that it's in the back of his throat, I'm gonna have him lean forward and take some sips of water while I proceed to advance the tubing. Okay, so what I'm gonna do is take a piece of tape. Okay. Wow. So, down the middle, just like this. Okay. And then to his gown. So once that is in, we're going to verify placement based on your facility's recommendations. At my hospital, we call for a chest x-ray to the bedside. I've also heard of people aspirating stomach contents and using the litmus paper as long as it's below a 5.5. You're where you need to be. So after this, we have an order for low intermittent suction for bowel rest. So after the placement comes back, I'm going to go ahead and hook them up to low intermittent suction. Okay, so he is hooked up to low intermittent suction. I'm going to go and document all the information I used, the size of the tube, how he handled the procedure, and if there was any abnormal findings, which in this case there was not. It looks like I'm coming back in 3 days. Today's 3 days later. I'm going to be performing a gastric lavage. I'm just looking at my order sheet. So gastric lavage with normal saline until contents are clear. So I've got my normal saline in here. Here's my reservoir bucket and my aspirator. Okay, so Mr. Gastritis, it looks like your doctor put in an order for you to have some lavage, so I'm going to take a look and I'm going to instill some normal saline into your stomach and see until the contents run clear. Okay, so I'm going to turn off suctioning because he's been on low intermittent suctioning. He is no longer on suctioning. Okay. Okay. So I can pinch this tube right here, clamp it just in case if something was coming up, or before if I want to empty it into the container and then release it so it all goes down at once with no air bubbles, just to help with discomfort. So I'm going to clamp it using my finger. I've got my 50 mils of normal saline. I'm going to put it in for gravity, let it go all the way down, attach my suction, aspirate the contents. This looks like it's not clear, so it's still dirty. I'm going to perform it one more time. Clamp with the finger, instill the normal saline, let it run. Aspirate the contents. It looks like it's clear this time, so I'm going to Fasten it back to his gown. If the orders say put him back onto suctioning, I'm going to put him back onto suctioning, or gastrographing if they're going down for imaging or what have you. I would, before I would do this, I would verify placement using the stomach contents below 5.5. I would do an abdominal assessment, making sure that listening, inspecting, palpating before I would do a lavage, and the appropriate positioning for the client. And lavage is left side lying. Now we have an order for administering Glucerna, 100 mLs with 50 ml flush. Okay. As long as the residual is less than 150. Okay. So, washing hands, putting on new gloves. I would check the residual. There was only 30 mLs, so I can proceed with the feeding. Assess for any nausea, vomiting, tenderness, anything like that that might advise me to hold off on the feeding until that subsides. So I've got my Glucerna. Mr. Gastritis, I'm going to go ahead with your Glucerna tube feeding for that is scheduled right now. So it looks like the flush sometimes it says flush before and after. Sometimes it's just after. I believe this is before and after, so what I'm going to do is have his NG tube. Flush with 50 mLs of water, and then I'm going to go ahead and instill the 100 mLs of Glucerna. And then another 50 mLs of water. Okay, I'm going to assess him for any nausea, vomiting, or if I was doing it on a kangaroo pup, I would hang it and put it to the appropriate feedings. I would also, after I was done with the feedings, I would make sure that his head is elevated to the appropriate height, his call light was in reach, and I would document his response to the procedures. Okay, thank you.